Dr. Alan Christensen here, and I want to talk about a very important issue, female hormones. So women and men make some hormones that are the same, those from the thyroid, those from the adrenals. Women make some hormones that are in very different amounts and have very different roles than what men make. The main ones are estradiol, which is a kind of estrogen, and progesterone and testosterone. And those are the big three that are primarily made by the ovaries. Now, they decline through adulthood. Testosterone comes down the earliest. There's actually been data saying that now most women, even before they enter their 40s, they've probably had a big drop-off in testosterone. Now, we hear about testosterone for guys, but women make it too, and it does a lot of the same things, and it's just as important. Of course, women make a lot less. It's about a 10-to-1 difference between a male and a female level. But the female level is critical. When that's not there, women are going to be more fatigued, they won't have a healthy libido, and they won't really recover very well from exercise. They're not going to really want to go train hard because it's just not fun and because they're not getting much out of it. So this one can come down even in the 30s, not too uncommonly. The other two big hormones, the progesterone and the estradiol, they have a lot of roles to play in reproduction, but also in menstrual cycles. So we've got perimenopause, which is a change in hormones leading up to menopause that occurs before the cycles stop altogether. For the average woman, that starts in mid-40s. It's not too uncommon for it to be a little earlier, a little later, but mid-40s is most typical. The first step of perimenopause takes place after testosterone's already come down. That's a decline in progesterone. Generally, when progesterone comes down, there's some change in the menstrual cycles. They could be closer together at first, there could be some early hot flashes or night sweats, and we could see more premenstrual symptoms or some combination of that. That's usually the first stage of perimenopause. The final stage of perimenopause is the drop-off of estrogen. When that occurs, the cycles start to get more sporadic and further apart. Here's a rule of thumb. When your cycles start to get goofy, you've usually got about 18 months left before menopause. So that's a pretty good time estimate. Now, menopause is no menstrual cycles for a calendar year. Once it's been a year, it's not common, not impossible, but not common to get more menstrual cycles. So if you've had a drop-off early, there may be some clear reasons for that. There could be a change in your thyroid, your adrenals might not be working right, there could be blood sugar control problems from the pancreas. There are often corrective steps that can bring levels back to healthy ranges. And the cool thing is, when they're normal again, we see all those negative symptoms clear up. Another big thing those hormones do is they affect your body composition, lean mass to fat mass, but also your tissue growth. So how thick collagen is. There's actually a 5-fold difference in women that have healthy hormones versus those that don't in terms of how thick their collagen is. So a really big factor for health. We've also learned that the brain is more responsive to some of these hormones than even the uterus is. So there's a huge change in short-term memory, mood, mental focus, and depth of sleep with the hormonal shifts. And there are ways now that can safely bring hormones back to a good range. Some things to look for: you want doctors that take a close look at what your levels are. Women are very different. Not everyone has the same hormone levels, even with the same symptoms. The next step is the doctor should really look at how you respond to treatment. Whatever's being done to help your hormones, it's got to be exactingly measured. People will respond differently even if they both have the same deficiencies and they're both on the same treatments. So you've got to be dialed in and brought to a good range. And you want to be sure that your safety is first and foremost. There are good therapies that can be done that actually lower your risk of things like breast cancer, ovarian cancer, and stroke as they manage your hormones. And there are therapies that do raise the risk for those diseases. So you want to be sure safety is in the forefront. So be aware of your hormones. If they change, if they shift, like all things, never assume you're stuck with bad elements of your health. It can always improve, it can always get better. Never give up on yourself.